If you have inflammatory arthritis, should you be doing high intensity interval training, or could it make things worse? The latest science just gave us a clear answer. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. If you've been diagnosed with rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis, you've probably heard that exercise is good for you. But here's the question: does that include high-intensity exercises? For many patients, exercise ends up being walking, stretching, or maybe some gentle yoga. But higher intensity workouts, that's where the hesitation comes in, because the fear is that they might trigger flares or make joints worse. A recent BMC Rheumatology article, a meta-analysis published in 2025, pulled together the best evidence on this exact question. And today, we're going to break down what HIIT exercises are and why it's different from traditional exercise. We'll also explain what a meta-analysis is and why this study's conclusions carry extra weight. We'll also review exactly what this research found about safety and benefits for people with inflammatory arthritis. We'll walk through how to approach HIIT exercises safely if you have inflammatory arthritis and when to avoid it. High-intensity interval training, or HIIT exercises, are a workout method where you alternate short bursts of vigorous activity with periods of rest or lighter movement. For example, 30 seconds of fast cycling followed by a minute of easy cycling, and repeating that for 15 to 20 minutes. It can be done with running, swimming, rowing, bodyweight exercises, almost anything. The goal is to push your heart, lungs, and muscles harder for shorter intervals instead of holding a steady, moderate pace. In the general population, HIIT exercises have been shown to improve cardiovascular health, boost metabolic efficiency, build endurance in less total time. Both inflammatory arthritis, we need to be more thoughtful. Inflammatory arthritis is not just wear and tear. It's an immune system that's overactive and miscommunicating with your joints. This can cause joint pain and swelling, morning stiffness, fatigue, a higher risk of heart disease. So the question becomes, can you safely push your body harder without worsening joint inflammation? So what is a meta-analysis? Before we dive into the results, it's worth explaining what makes this study important. A meta-analysis is like the ultimate evidence roundup. Instead of looking at just one trial, researchers combine data from multiple high-quality studies that looked at the same question. Why that matters. The bigger picture is that it captures trends that a single study might miss. You can also get more statistical power. By pooling participants, it can give you a more accurate or intense result. It can also be used as a quality filter. Only studies that meet strict scientific standards are included. You want to think of it like getting the opinion of 10 expert witnesses instead of just one. So in the case of this particular article, and again, this is an article from BMC Rheumatology in 2025, this review specifically looked at HIIT exercises in adults with inflammatory arthritis, including people that have rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. How do they do this? They searched the medical database for randomized controlled trials where high-intensity interval training was the main intervention. They compared HIIT exercises to moderate intensity training or usual care. They measured aerobic fitness, pain, function, disease activity of their inflammatory arthritis, inflammatory markers, and adverse events. So who was in the study? There were several hundred participants aged between 30 to 65. Most had stable inflammatory arthritis disease and were on medication. There were no significant high-grade flares at the start of the study amongst their participants as well. RA and axial spondyloarthritis, or ankylosing spondylitis, were the most common, and psoriatic arthritis made up a smaller share of patients. So what did the high intensity interval training look like? Basically, it was 2 to 3 sessions per week of 10 to 40 minutes each. Intervals of 30 seconds to 2 minutes at high effort with equal or longer recovery periods. Usually on a stationary bike or treadmills to minimize joint stress. And the program length lasted anywhere from 8 to 16 weeks. Some of the key findings included that aerobic fitness, there's a significant improvement compared to usual care. That makes sense. And sometimes more than the moderate intensity training group as well. In terms of pain, there was no worsening in most cases and modest improvement in some cases as well. Function, there's better walking tests, strength, and self-reported activity levels as well in the treated group. Disease activity, there was no increase in disease activity on average or other disease activity scores when they looked at their cohort of patients. In terms of inflammatory markers like your CRP and sedimentation rates, these were stable or slightly better compared to the non-treatment group. In terms of safety, there was rare, mild side effects like temporary muscle soreness, but no other significant side effects from this intervention. In terms of limitations, these are mainly stable patients, so the results may not apply as easily if you're in a flare-up. All programs were supervised, and outcomes might differ if they're done unsupervised. And in terms of long-term effects, this really only looked at for a few months, so anything beyond 4 to 6 months still needs to be studied in a longer format. So let's talk about why high-intensity interval training may be helpful for people with inflammatory arthritis. Number one is heart health. People with inflammatory arthritis have higher rates of cardiovascular disease. HIIT exercises are an efficient way for heart conditioning. And there's muscle support. Stronger muscles mean better joint stability. HIIT training can give you that. Metabolic boost. Improved glucose tolerance due to higher level intensity training may indirectly help inflammation as well. So when could HIIT training be risky? You want to avoid high interval intensity training if you have active joint swelling or an ongoing flare-up, you're recovering from a recent injury or surgery, you have unstable joints from advanced disease. You want to make sure you're in a safe position before you start to do more dynamic, intense activity. Or if you haven't had your heart health assessed, especially if you have other risk factors for heart disease. So how can you start HIIT exercises safely? Step one is get medical clearance, discuss your current disease status, joint stability, and exercise history with your rheumatologist or your primary care doctor. Step two, you want to pick joint-friendly options, such as stationary bike, elliptical, swimming, or rowing machine. If your body can handle more, slowly push and progressively see how much more you can do. Step three, start low and slowly build up over time. So for example, begin with 15 to 30 seconds of higher effort, followed by 60 seconds of recovery, and then slowly increase that over time. Increase intensity and duration gradually as tolerated. Step four, monitor your body's response. Mild muscle soreness is normal and expected. New or sharp joint pain can be a red flag. And keep a symptom log to spot patterns to see how well you are responding to this kind of exercise. And step five, recovery matters. Stretch and mobilize before and after workouts. And of course, get adequate rest and sleep as well. And lastly, support your body with excellent anti-inflammatory nutrition parameters. Here's an example of a real patient, one of my own patients, with psoriatic arthritis. She wanted to improve her fitness, but feared flaring her joints if she did that. She started with 2 bicycling HIIT sessions a week, 10 minutes each, under supervision. She gradually increased that to 20 and eventually 30 minutes, 3 times per week. After 6 weeks, she had better aerobic capacity, less morning stiffness, and even a slightly lower CRP marker. How about some frequently asked questions? Number one, are HIIT exercises better than walking for arthritis? Not necessarily. It's not a matter of what's better or not. It's just that it may be more time efficient for certain goals. Both can be valuable, however. Question 2, can HIIT exercises reverse joint damage? Unfortunately, no, it cannot. Exercise can improve function and reduce pain, but structural damage generally needs additional treatment beyond that. And question 3, should you do HIIT exercises during a flare-up? I'd recommend avoiding that. Stick to a gentle movement routine if you're flaring, and then sort of reincorporate more intense activity after your flare-up resolves. Some key takeaways from this topic: HIIT exercises can be safe and beneficial for many people with well-controlled inflammatory arthritis. So recent 2025 meta-analysis found no evidence of worsening pain, inflammation, or joint damage in stable inflammatory arthritis patients who took on a high-intensity interval training program. Start gradually, pick low-impact exercises to begin with, and work with your healthcare provider to help maximize your goals. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and living healthy. Until we connect again, see you next time and live well.